Every step you take after 50 either rebuilds your body or quietly tears it down. There is no neutral. And 90% of people over 60 are walking in a way that compresses their spine, starves their brain of oxygen, and inflames the very joints they're trying to protect. You probably believe walking is the safest exercise there is. That belief is exactly why the damage goes unnoticed for years. In the next few minutes, I'm going to show you the 7 mechanical errors that turn the simplest movement humans were built for into a slow drain on your health, and the one specific correction that changes everything in less than a week. But here's what almost nobody talks about. There is one thing, one single habit most people have during their walks that quietly cancels out every benefit of the walk itself. You can do all 7 corrections perfectly, and if this one thing is wrong, your body responds as if you never walked at all. I'll come back to this, because it's the most uncomfortable truth in this entire field. In 20 years of studying human movement through Western biomechanics, traditional Chinese medicine, and herbal pharmacology, I've come to one conclusion. Walking is not exercise. Walking is a diagnostic tool. The way you walk reveals what's happening inside you, and the way you change your walk can rewrite what happens next. Let's start with the first mistake, the one that's probably happening to you right now, even when you're sitting still. Look at the next person over 60 walking down the street. Watch where their head is positioned in space. 9 times out of 10, the head is jutting forward, sometimes by 2, 3, even 4 inches in front of the shoulders. This is not aging. This is loading. Your head weighs about 10 to 12 pounds when held directly over your spine. For every inch it tilts forward, the effective weight on your cervical vertebrae roughly doubles. 2 inches forward, your neck is supporting 24 pounds. 3 inches, closer to 36. All day, every day, with every step you take. Here's what most sources won't tell you. The forward head position doesn't just damage your neck. It compresses the vertebral arteries, the 2 vessels that run through your cervical spine and supply blood directly to your brainstem. Compression here means reduced cerebral perfusion. Reduced perfusion means slower thinking, dizziness when standing up, ringing in the ears, and a much higher load on the small vessels in your brain. In plain terms, your posture is starving your brain a little more with every step. Traditional Chinese medicine described this exact issue more than 2,000 years ago. The governing vessel, Du Mai, runs along the spine and ends at the top of the head. Stagnation in this channel was associated with mental fog, headaches, and what they called rising deficiency. Different language, same vessels, same compression. The fix is mechanical and immediate. As you walk, imagine a thin string pulling the crown of your head straight up toward the sky. Not your chin, your crown. Your chin should naturally tuck slightly, shoulders drop. The whole spine elongates. Try it for 10 steps right now if you're standing. You'll feel your breathing deepen within 3 breaths. That's not coincidence. That's your diaphragm finally having room to move. Listen to your feet when you walk. Really listen. If you hear a hard thump with each heel strike, you're driving impact directly into your knees, hips, and lumbar spine. The heel slam is the most common mechanical error after 50, and it's the one almost no doctor will mention. Here's why it happens. As we age, the small stabilizer muscles in our feet weaken. The arch flattens slightly. The forward swing of the leg loses control. The result? The heel doesn't land. It crashes. Each crash sends a shockwave through the body. Studies measuring ground reaction forces show that a hard heel strike generates impact equal to 1.5 to 2 times your body weight, transmitted directly into the joint structures. For a person weighing 180 pounds, that's roughly 300 pounds of force per step, multiplied by 7,000 steps a day, multiplied by years. This is where the morning knee pain comes from, not arthritis alone, not cartilage thinning by itself. The accumulated micro-trauma from 1,000 uncontrolled landings. Here's the paradox. The very people most worried about their joints are usually walking the hardest on them. The correction is subtle but life-changing. Instead of stepping forward and crashing down, you step forward and roll. Heel touches first, gently. Then the foot rolls smoothly through the midfoot to the toes. Your knee should be slightly soft, never locked. The whole motion should feel like rolling a wheel, not stamping a stamp. When you do this correctly, walking becomes silent, almost no sound from the foot. That's your tissues thanking you. But silence in your steps is only the beginning. Because there's a second layer to walking damage that has nothing to do with your feet at all. Most people over 50 hold their breath while walking and have no idea they're doing it. It happens like this. You're walking. You start thinking about the bills, the conversation you had yesterday, what you need to buy. Your breathing becomes shallow. Then it pauses. Then a sigh. Then shallow again. Over 20 minutes of walking, you've taken maybe half the oxygen your body actually needed. Walking should oxygenate. Held breath walking does the opposite. It elevates carbon dioxide in the blood, raises cortisol, and creates a peculiar state where your body is physically active but biochemically stressed. You finish the walk feeling more tired than when you started, and you blame your age. Your age has nothing to do with it. The fix is rhythmic breathing. 3 steps in through the nose, 3 steps out through the nose. If 3 feels too long, start with 2. The rhythm matters more than the count. The nose matters because nasal breathing produces nitric oxide, a molecule that dilates your blood vessels and increases oxygen delivery to your tissues by 10 to 15% compared to mouth breathing. In Chinese tradition, walking with controlled breath was called moving qi. The mechanism they were describing, circulation of breath, blood, and lymph through coordinated motion, is exactly what modern research now confirms about nitric oxide and vascular tone. Same body, 2 languages. The shuffle is when your feet stop fully leaving the ground, steps shorten, hips stiffen, arms stop swinging. The walk turns from movement into a slow drag. This is the single biggest predictor of falls in adults over 60. Not weakness, not balance loss, the shuffle. Here's why it's dangerous. When the foot doesn't fully clear the ground, your toes are constantly catching on small irregularities. The edge of a rug, a slightly raised paving stone, a doorway threshold. The brain stops anticipating these obstacles because the foot has been barely making it for so long that the system recalibrates downward. Then one day, a real catch, a fall. The shuffle also stiffens the hip flexors, which pulls the lumbar spine into a forward tilt, which creates the lower back pain almost everyone over 60 complains about. Now, here's your base protocol, the one you can start applying today. The 4-correction daily walk. 1. Crown of the head pulled up, long spine, chin slightly tucked. 2. Soft, rolling foot strike, heel, midfoot, toes, silent steps. 3. Rhythmic nasal breathing, 3 in, 3 out. 4. Active stride, heel of the back foot fully lifts off the ground before the next step begins. 20 to 30 minutes, once a day. That's the foundation. If you do nothing else from this entire conversation, do these 4 things, and within 10 to 14 days, you will feel a measurable change. Less morning stiffness, clearer thinking, better sleep. The joint pain that you assumed was permanent will start to ease. But, and this is important, these 4 corrections give you about 70% of the available benefit. The remaining 30% depends on 3 deeper layers most people never reach. And there's also one specific habit that, if you're doing it during your walks, will quietly undo most of these gains. We'll get to that. It's the part that surprises people the most. For now, master the 4 corrections. Then we go deeper. When you walk matters almost as much as how you walk. The most common mistake, walking immediately after meals, specifically in the first 10 minutes. During those first minutes, blood is being redirected to the digestive tract. Your stomach has just received a workload. If you start walking immediately, you force the cardiovascular system to compete with digestion. The result? Incomplete digestion, gas, bloating, and a feeling of heaviness that lingers for hours. The opposite mistake is walking too late after meals. After 90 minutes, the postprandial blood sugar spike is already done. The walk no longer helps regulate glucose. The optimal window, 20 to 40 minutes after eating. Light walking in this window has been shown to reduce post-meal blood sugar peaks by 20 to 30%. For people over 50, This single timing adjustment can change the entire metabolic picture without any medication. Now, the morning question. Should you walk first thing in the morning? Here's the part most fitness advice gets wrong. In the first 1 to 2 hours after waking, your blood viscosity is at its highest of the entire 24-hour cycle. The clotting system is more active. Cortisol is climbing. Walking immediately on an empty stomach in this state forces your cardiovascular system to handle a viscous bloodstream under stress. The correction is simple. Drink 300 to 400 milliliters of warm water first. Wait 15 to 20 minutes, then walk. The water lowers blood viscosity. The weight allows your nervous system to stabilize. Now your walk supports your body instead of straining it. This is what Chinese practitioners meant when they said, warm the body before moving it. The mechanism is biochemical. The wisdom is ancient. Watch how older adults hold their arms when walking, pressed against the body, sometimes clasped behind the back, sometimes folded in front. The arms are doing nothing. This is one of the most underestimated mistakes. The natural arm swing during walking is not decorative. It's a counter-rotation that takes load off the lumbar spine. Without arm swing, the entire torsional force of each step transfers directly into the lower vertebrae. Over years, this is one of the primary causes of degenerative changes in the lumbar discs. Locked arms also restrict ribcage expansion. Less expansion means shallower breathing. Shallower breathing means less oxygen, more carbon dioxide retention, and increased sympathetic nervous system activation. You walk to relax and end up more tense. The eyes down problem compounds it. When you stare at the ground in front of you, your cervical spine flexes forward, your visual field narrows, and your vestibular system, the inner ear balance system, gets less input. Less input means worse balance. Worse balance means more fear of falling. More fear means more eyes down walking. The loop tightens with every step. The fix has two parts. First, let your arms swing naturally. Opposite arm to opposite leg. Elbow slightly bent, not big, not exaggerated, just unlocked. Second, lift your gaze. Look 10 to 15 feet ahead, not at your feet. Your brain is fully capable of mapping the ground in your peripheral vision. Trusting it again is the practice. In traditional Chinese medicine, the eyes are connected to the liver channel, and downward gaze was associated with stagnation in this channel, heaviness, irritability, and what they called stuck qi. Modern neurology describes the same loop through the vagus nerve and vestibular system. Two languages, one body. The seventh mistake is walking the same flat path every single day. Flat, predictable surfaces are comfortable and biologically lazy. The small stabilizer muscles in your ankles, knees, and hips only activate when the ground varies. Smooth concrete or treadmill belts let those muscles atrophy quietly. After 2 or 3 years of flat-only walking, the foot loses its sensory map. Proprioception, your body's sense of where it is in space, declines. Falls increase. The correction is to introduce variation at least twice a week. A grass field, a gravel path, a gentle hill, even uneven sidewalks. The instability is exactly what your nervous system needs to stay sharp. Walking on uneven terrain also activates the small intrinsic foot muscles, which support arch integrity. A maintained arch reduces knee pain, hip pain, and lower back pain, all from the ground up. For supporting joint and connective tissue health during this transition, 3 plants have meaningful research behind them. First, turmeric, the root used for thousands of years in both Indian and Chinese systems. Its active compound, curcumin, reduces inflammatory markers like C-reactive protein and interleukin-6 in clinical trials. The catch: curcumin alone has poor absorption. It must be combined with black pepper extract, piperine, or consumed in fat to absorb properly. Standard supportive dose is around 500 milligrams of curcumin extract with 5 milligrams of piperine, taken with a meal containing fat. Second, Boswellia serrata, also known as frankincense resin. Its active compounds are boswellic acids, which inhibit a specific inflammatory enzyme called 5-lipoxygenase. Studies show meaningful improvement in joint discomfort and mobility within 4 to 8 weeks at doses around 300 to 400 milligrams of standardized extract per day. Third, collagen peptides. Not herbal, but worth mentioning. Hydrolyzed collagen at 10 to 15 grams per day, combined with vitamin C, supports cartilage matrix maintenance. The body needs the building blocks. After 50, you produce them slower than you lose them. These are tools, not magic. They support the work the corrections do. Here's what I promised at the start. The one habit most people have during their walks that quietly cancels almost every benefit. It's the phone. Not the phone in your pocket, the phone in your hand. When you walk while looking at a screen, 3 things happen simultaneously, and each one undoes a different layer of what we just discussed. First, your head drops forward. We already covered what that does to vertebral arteries, cervical compression, and brain perfusion. A phone in the hand, held at chest level, drops the head forward by an additional 2 to 3 inches beyond normal forward head posture. You're not just walking with bad posture, you're walking with extreme posture. Second, your stride shortens automatically. The brain prioritizes visual focus over locomotion. Steps become shorter, slower, and shuffling. The shuffle pattern we discussed becomes the default. The arm holding the phone stops swinging entirely. The torsional load returns to your lumbar spine. Within minutes, you've reintroduced every mechanical problem the corrections were designed to fix. Third, and this is the part most people never consider, the cognitive load of the screen activates your sympathetic nervous system. Walking is supposed to lower cortisol and shift you toward parasympathetic recovery. A screen does the opposite. You're physically walking, but biochemically you're in a stress state. The cardiovascular benefit drops by an estimated 40 to 60%. The mood-regulating effect? Gone. The blood sugar regulation we discussed? Significantly reduced. This is the habit that cancels the walk. There is one more layer. Listening to fast, intense audio, news, dramatic podcasts, anxiety-inducing content produces a similar, though milder version of the same effect. The body cannot fully relax when the ears are feeding it stress. The correction is uncomfortable but simple. The phone goes in the pocket. The walk becomes the walk. If you must listen to something, choose calm music, slow audiobooks, or, and this is what I recommend most, nothing at all. 20 to 30 minutes of silent walking each day is one of the most underrated tools available to anyone over 50 for cognitive sharpness, emotional regulation, and what some research now calls brain noise reduction. This is the missing 30%. Not a supplement, not a special technique, just the willingness to walk without a screen in front of your face. Without this, the 4 corrections give you a fraction of what they could. With this, the whole system finally clicks. Walking is the oldest form of medicine the human body knows. Older than herbs, older than acupuncture, older than any clinical trial. Your nervous system was built around the rhythm of stepping. Your circulation depends on the muscle pump of the lower legs. Your brain releases its most powerful regenerative signals, including BDNF, brain-derived neurotrophic factor, primarily during sustained, rhythmic, low-intensity movement. Walking correctly does not require expense, does not require equipment, does not require a prescription. It requires attention. For the next 14 days, walk with the 4 corrections. Choose the right time window after meals. Vary your terrain twice a week. Put the phone away. Add turmeric or Boswellia if your joints need support. And notice, really notice what changes. The morning stiffness softens, sleep deepens, thinking becomes clearer, mood stabilizes. The fog that you assumed was just getting older begins to lift. Your body did not stop responding when you turned 50. It started responding to different signals. The signals it now needs are not harder, they are more precise. Walking correctly is one of the most precise signals you can send. 20 years of studying this from 3 different angles, Western biomechanics, Chinese tradition, herbal pharmacology, keeps pointing to the same place. The body remembers how to repair itself. You only have to stop interrupting the process. Start tomorrow. Start with 1 correction, Then add the next. Your next step is either the one that broke you or the one that brought you back. There is no neutral. There never was.